Hey everyone, I'm going to talk about magnesium today. I think magnesium should be a familiar element to everyone in this course. We not only learned that in chem principle, but we also heard the name magnesium many times in our daily life. So magnesium was first time being recorded in 1618. A farmer saw a greenish color on his iron fence, and that was later turned out to be magnesium. And in 1755, a chemist who called Joseph Black recognized magnesium as a new element. And in 1808, Davy first isolated magnesium by electrolyzing a mixture of magnesia and mercury oxide. And in that same year, Davy suggested the name magnium for magnesium, but the name was changed. But the name was not accepted, and the name magnesium was chosen and used until now. In 1833, when I say we, I mean human beings were first able to produce magnesium metals by electrolysis of fused anhydride of magnesium chloride. And how does magnesium work in our body? There are two ways or two mechanisms that magnesium can work in human body. First, it works on endothelium. The magnesium will bind to platelets and stop platelets from stick to each other. So the platelet would not be that sticky as it before, so the inflammation and the response to injury will decrease. And when magnesium work on the smooth muscle, it binds to the sarcoplasmic reticulum and stop the calcium to being released. Some of you may know the calcium is important for muscle contraction. So when calcium is not being released, the muscle cannot contract. Therefore, the magnesium will cause the muscle to relaxation, and cause vasodilation and decrease the vascular resistance. So, what are some use of magnesium in medicine? First, magnesium can be used to strengthen human bones and prevent or relieve headache. Or magnesium can be also used as a treat for emotional disease. So basically, instead of real medicine, it works more like a supporting drug. But it does help an illness like constipation. So the constipation patient who were taking diloxetine, that was a drug to treat like some emotional disease like depression or anxious. But the side effect of the diloxetine is to cause constipation. And this study showed when patients who have constipation took magnesium oxide, will decrease the diloxetine concentration in their body, therefore to decrease the level of constipation in patients. So we can see here in the figure, the control group was giving platelet, and we can see a significantly decreased or difference between the experimental group and control group. And magnesium was also used to balance or level off the calcium level in the human body, as I mentioned before. Why is it important? Since the if the calcium level is too high, your leg or hand or anywhere you can find your smooth muscles will usually cramped, and that will cause another disease or illness. So the magnesium is able to balance the calcium level in the human body. We can see in the control group, the calcium magnesium ratio means if the ratio is higher, that means the more calcium is still present in the human body. So we can see after intervention, which means the magnesium magnesium drug was given to the participant, and we can see the calcium magnesium ratio was decreased from 4.54 to 4.11, which in the control group, when the magnesium was not given, the ratio is actually increased from 4.4 to 4.68. In that pattern, if those participants were not taking enough magnesiums, they will have highly risk of having leg cramp or muscle cramps. But there are also damage to the magnesium. In this study, that shows the harmful side of magnesium in pregnant women. So the DBP is diastolic blood pressure, and in the pregnant women who took magnesium have higher change of DBP than normal than control group pregnant women, which could be which is definitely a harmful thing, since the higher the blood pressure, the higher the risk of having like burst of blood vessels and causing and harm to the fetus and the mother. So that's one harmful side of magnesium, which taking consideration when giving medicine to pregnant women. And there's another question: can you overdose on magnesium? Actually not. The risk of ever experiencing a magnesium overdose is extremely low, since the if you really want to overdose on magnesium, you need at least like 700 megagrams of magnesium in your body, which is hard to reach just by taking magnesium pills or having food that contain magnesium. And also magnesium will quickly be excreted by your kidney and excreted out of your body. So it's really hard to get overdose of magnesium. However, it's still possible to happen, especially for people who have kidney function impaired kidney function, which means they cannot get magnesium out of their body as easy as normal healthy people. So they might have magnesium stuck in their body, and days by days they might overdose of magnesium, but this overdose of magnesium could be treated, and there are ways to help people um, help people not die on the magnesium overdose. And that's my work cited. I know I didn't do the presentation fluently, and thank you so much for everyone who listened to here, who watched to here, and welcome to post any question to my forum session. Thank you.